So I think we'll get started. We've got a number of participants already joined, so welcome everybody. Thank you for joining us today for our Ask a Dietitian webinar. I'm Lisa and I'm one of the specialist nurses here at Pancreatic Cancer UK. We speak to around 2,000 people affected by pancreatic cancer each year on our support line. And I'd say that many, if not most people who call us have issues or questions around diet, digestion, pancreatic enzymes such as prion. So I'm delighted today that you've joined us, and our main speaker today is going to be Rachel Caddy, who's a specialist HPB dietitian from the Liverpool University NHS Foundation Trust, and that is a mouthful to say one, but Rachel, welcome and thank you. She's going to be discussing these topics around diet and pancreatic cancer and much more. But we'd also like to extend our wishes to Lauren Roberts, who was going to be joining and sharing the speaker role with Rachel today, but unfortunately she's poorly, so can't join us. So to Lauren, get better soon. And a huge thank you from me, so I don't have to do all the presenting, but a huge thank you to Rachel for taking on the whole session today. There are a few bits of housekeeping that I'll just go through first, if I might, before I hand over to Rachel, so bear with me, but I hope you're all sitting comfortably and all ready to listen. So housekeeping wise, there will be a question and answer session at the end of our webinar, and you can see, if you're not familiar with Zoom, there's an icon, a Q&A icon on your screen, which looks like two speech bubbles. So if you want to ask a question, just type into this box. And I say feel free to ask questions throughout the session. We'll actually respond to these at the end of Rachel's talk, but please just don't wait until the end to post them. You can put them on whenever you like, but do be aware, if you've not done one of these sessions before, that everybody, all the attendees can see your question, which is absolutely fine. But if you want to take your name off it, you can ask your question anonymously if you prefer. And the other thing is, you'll see in the question and answer session, when the questions are there, you can press the thumbs up button, and that kind of upvotes the questions there. So if there's a particular question you want a quicker answer to, upvote it with a thumbs up. There also, just to warn you, there might be some questions that are highly specific or perhaps might fall outside of today's scope of the webinar. So please don't be offended, but if we think that we might answer some of those questions a bit more directly on the Q&A chat by typing an answer, or perhaps redirecting you to the support line as well. So I hope that's okay. One other thing just to mention is, if we have some people attending from overseas, you're very welcome and hi. But please just bear in mind that the information we're going to be talking about today is really based on the UK healthcare system. So it won't be necessarily specific to the country that you're calling from, if that's the case. But welcome anyway. And then a final note on questions is really, if there are any healthcare professionals that have joined us today, a big welcome to you too, but a polite reminder that really this session is intended more for patients and carers. Healthcare professionals are very welcome, but just I ask you to be mindful and sensitive. If you've got any questions you want to ask, just be mindful of the rest of the audience, if that's not too rude. And then just a note on recording, just to let you know, we are recording the session today. So it will be available on our website in the next couple of days. So feel free to either share it with family, friends, anybody else that might benefit from it. And please feel free to look back and watch it again if you think that would be helpful. And finally, just to let you know that the webinar, when it ends, you will be taken to a survey, which we'd be really, really, really grateful. And this is a plug from all of us at the charity. If you could give us some feedback, it should only take a couple of minutes. But there will be an option to just give us some feedback so that we can perhaps improve these sessions in the future, just to make sure that we're meeting everybody's needs. So a brief overview from me really about what else Pancreatic Cancer UK can do, what other support we can provide for you. So just a few words on these topics and headings I've just got here before I let Rachel speak. So some of you might have used our support line already, but the support line, if you didn't know, is run by a team of 7 friendly nurses. I say friendly, I'm one of them, but hopefully we're friendly. And between us, we've got over 3/4 of a century of experience of looking after people with pancreatic cancer. So you can contact us really about anything that's worrying you, whether it be about managing symptoms, questions about your diagnosis, treatment options, or really if you just feel like phoning up and speaking to somebody and sharing how you're feeling, we'd love to speak to you. That also goes for your family members and carers, and we'll also speak to healthcare professionals if they've got concerns or questions that they don't know how to answer. So you can see the telephone number on the screen, and you can phone that anytime you like, with the opening hours in the top right, which are usually Monday to Friday between 9 and 4. On Wednesdays, we don't open till 10. The idea is we get a little bit of time for some education for ourselves. You can also email us, thenurse@pancreaticcancer.org.uk is another way you can contact us. So we'd love to hear from you, me and my colleagues on the support line. So please get in touch either by phone or by email as you need. We've also got a range of information available for you. So things from short videos about pancreatic cancer, video about having chemotherapy or what it means to have surgery and what that might entail. Got lots of information on our website about treatment, managing side effects such as fatigue and taste changes, to fact sheets and booklets covering all of these topics and much, much more. So the publications are free to order, and you can also download them to read at home. So you can see the pancreaticcancer.org.uk/information. So that's where you will find the information that you can order. And also, if you look on our website, there is under the support for you tab, you can see the publications and information tab there, which will take you to the place where you can order our information. Online support sessions, if any of you have already joined some of these, I hope you found them useful. These are really have taken over from our pre-COVID face-to-face sessions that we used to run. So these are now support sessions that we offer online, and they're run mainly by the specialist nurses. We facilitate the discussions and give the attendees really a chance to share their experiences and ask questions. They're usually subject-specific sessions, which cover things like nutrition, chemotherapy, or symptom management. But we also have a little bit more of a casual cuppa sessions, which are more social, a bit more general, not necessarily subject-specific at all. And we run one for patients, which is coordinated actually by one of our volunteers rather than the nurses. And then we also run a separate cuppa for carers and family members and relatives, and that one is coordinated by one of the nurses. So again, you can join that via the support for you tab on our website or by the link that's on your screen at the moment. So we'd love to see for as many of those that you think might be helpful for you. Discussion forum. This is really a space for people to ask questions and to share their experiences, whether as a patient or a carer. And hopefully you'll find this is a friendly area where you can get support from others who might be treading the same path as you, or may have already trodden it and have been there and done that already. So this is another area which some people really like to interact with. And then finally from me, before I hand over to lovely Rach, is our side-by-side service. So this is really for people who are about to have or have already had surgery. And I refer to it perhaps wrongly, but a little bit like a buddy service. So we can link you up to talk with one of our trained volunteers who've previously had pancreatic surgery. And you can use these calls to ask questions about really what to expect, how was surgery for them, how was their recovery, what to expect. And you can talk to them about things that are worrying you, ask them if it was like this for them. Are your concerns not they're valid, but just share what you want with them to get the support that you need. How did they manage their career on after their operation, for example? So if you're approaching surgery or have just had an operation, please do ask about our side-by-side service. We'd be really happy to link you up with a volunteer to chat further. Again, you can find that through the link on the support for you tab. So I'm going to hand over to Rachel, who is very kindly going to talk a lot, I'm sure, about diet and pancreatic cancer. So thank you very much, Rachel.
Thank you, Lisa. That's great. Let me just get the presentation up here. So thanks, Lisa. As Lisa mentioned there, I am a dietitian. I work at the Royal Hospital, Liverpool, and I am a specialist nutrition support dietitian. My colleague Lauren, she works at the Clatterbridge Cancer Centre, and we both work with people who are affected by pancreatic cancer. So what we'll go through today is what I do as part of our jobs, the role of the pancreas, impact of pancreatic cancer, type 3C diabetes, eating with pancreatic cancer. There will be a section on duodenal stents, treatment side effects, and a myth busting section. There'll be lots to cover today, but there's a recording going to be available afterwards, so you can always go back and have a little look if we've skipped over something very quickly. So dietitians are qualified and regulated health professionals. We assess, diagnose and treat dietary and nutritional problems at an individual and wider public health level. We are regulated by the Health and Care Professions Council. So we're going to do a quick poll. Have you or your loved one been able to speak to a dietitian following the diagnosis of pancreatic cancer? Fantastic. So over half of you have been able to speak with a dietitian, which is wonderful. We know that malnutrition is very common in pancreatic cancer, and we'd hope that everybody would have some chance to speak with a dietitian. For those who haven't been able to, then this would cover the information that we would speak with our patients about, and hopefully it will clarify and reiterate what you may have already been spoken about when you have seen the dietitian. So as a dietitian, what we're aiming to do is to build somebody's strength, so optimize their what we call nutritional status. And this is to build their strength for further treatment. So that would include chemotherapy or surgery, and it would aiming overall to improve quality of life. So this is the pancreas. It's a gland that sits beneath the stomach, sits behind the stomach. It's got a really important role in digestion. One of the jobs of the pancreas is to produce digestive enzymes, which help to break down our foods into small enough pieces so our bowel can absorb everything properly. And the pancreas will also help us to control our blood sugar levels. So macronutrients, these are the foods that we eat in usually significant amounts to provide the body with energy. Micronutrients includes vitamins and minerals, which are equally important, but they're eaten in much smaller quantities. So we're going to have a quick look there at the macronutrients. These are the foods that fall into three main food groups that fall into the heading of macronutrients. So carbohydrates will provide our body with energy. And carbohydrates are found in bread, rice, pasta, bread products like chapati or naan, rice, cereals and potatoes. Proteins are the foods that will help to build our strength. So they're the building blocks of our muscles. It also helps with wound healing. So really important following a surgery to get enough protein foods in. So your protein sources would include meat, fish, eggs, dairy foods like cheese or milk or yogurt. And then there's vegan sources of protein as well. So nuts, tofu, lentils, and other pulses such as baked beans are all a really good source of protein. And fats. Our fats will fall into two categories. We've got saturated fat and unsaturated fats. Our unsaturated fats will be found in foods like oily fish, nuts, olive oils. And then saturated fats will be found in foods like cheese, butter, cakes and biscuits, that type of thing. Fats are very, very helpful because they provide us lots of energy, so lots of calories, and they often help our food taste really good as well. So whenever we eat any of our macronutrients or any of our foods, the food travels down the esophagus, the food pipe, into the stomach, and then moves from the stomach through into the top part of the bowel, the duodenum. The pancreas also joins the duodenum. And one of the jobs of the pancreas is to produce those enzymes. So digestive enzymes are made in the pancreas and they move along the main pancreatic duct and are released into the duodenum to mix with the food that we've eaten. And different enzymes work on different macronutrients. So amylase works on carbohydrates, protease works on protein, and lipase works on fats. And when the enzymes mix with the food, it breaks them down into small enough pieces so our bowel can absorb everything properly. This is absorption. After absorption, the nutrients go into our bloodstream and then into our cells to be used by our body as fuel. But what we can see in pancreatic cancer is that maybe there's damage to some of the cells, so they're not able to make as many enzymes anymore, or there's a blockage, so for example from a tumour, which stops the enzymes travelling down that pancreatic duct and getting to the small bowel. So that means that the enzymes aren't able to work on the macronutrients, meaning that they're not able to break the food down into small enough pieces to be absorbed. And then what we see then is malabsorption. This is really common in pancreatic cancer, and symptoms that we see with malabsorption are greasy, oily, pale stools, sometimes yellow or orangey, often of a large volume, that are very difficult to flush away and can be very smelly. Bloating, abdominal pain, feeling full very quickly, urgency, so having to run to the toilet quite soon after you've eaten, and weight loss are all really common symptoms of malabsorption. And we know that malabsorption leads very quickly to malnutrition if it's left untreated. So malabsorption is almost like the body is starving, because when the foods we eat aren't able to be absorbed, then the body can't use those nutrients as energy. So the body turns on itself to use stores of fuel, and that would include stores of fat and stores of proteins. That would be our muscle. So what we can see is when somebody is malabsorbing, they lose weight very quickly, and this can lead to malnutrition very quickly. So with malnutrition, we will see rapid and significant weight loss. That is more than 10% of their normal body weight in a short period, so a few weeks normally. But when I speak with my patients about weight loss, what I really mean is strength loss, because when the body is using its own stores of muscle as fuel, then we see that the muscle mass depletes, gets much lower, and then people lose lots and lots of weight. Alongside this strength loss or this weight loss, we see fatigue, low mood, lack of energy. We know when somebody is malnourished that their immune system doesn't work as well, so they're more at risk of picking up infections. And we know overall that if somebody is malnourished, this reduces their overall quality of life. Now, we know if someone's malnourished as well, that this can impact on how well they're able to tolerate their treatment. So if somebody is malnourished going into chemotherapy, they don't tolerate it quite as well as somebody who is well nourished. We also know if somebody is malnourished going into surgery, it can take them a lot longer to recover compared to somebody who's well nourished. And what we highlight as well, that is anybody with any BMI can be malnourished. So if somebody has a high BMI, but they have lost more than 10% of their normal body weight in a period of weeks unintentionally, then they are malnourished. So what we're aiming to do as dietitians is to kind of stop that malnutrition and reverse it if we can. And partly that is through eating well with pancreatic cancer, but also by using medication that can help to stop malnutrition by optimizing people's absorption. And that would be pancreatic enzyme replacement therapy. So are you or your loved one taking pancreatic enzyme replacement therapy, such as Creon or Nutrizyme? Oh, fantastic. So that is the majority of you who are taking pancreatic enzymes, and that's wonderful, because there was a survey done, which I think it was 2018, that showed that only half of people with pancreatic cancer were prescribed pancreatic enzyme replacement therapy. So pancreatic enzyme replacement therapy is a replacement of the enzymes that the pancreas normally makes. If the enzymes aren't being made by the pancreas, or they're not able to get to where they need to go, so the bowel, to work on that food, the pancreatic enzyme replacement therapy, or the PERT tablets, do what the enzyme's job would do, but in a tablet form. If you aren't prescribed PERT, I would get a prescription. So you'll need to speak with your GP or with your specialist nurse to get a prescription of your PERT capsules, because they're really important in stopping and reversing malnutrition, because your PERT capsules are there to help you absorb all your nutrients from your food. And we know if somebody is taking PERT, then they may have an enhanced quality of life. They have improved overall survival. They obtain a better symptom score, and they may tolerate their treatment better. And when taken correctly, we know that PERT will aid adequate absorption of nutrients with reduced symptoms of malabsorption, aiming for formed normal colour stools, and we may see weight maintenance or weight regain, and overall an improved quality of life. The best way to take PERT capsules is with every meal, every snack, and every nourishing drink. So we count nourishing drinks as anything that's milky, so anything that's made with more than half milk. So a cappuccino, a hot chocolate, a milkshake, they would all require some PERT capsules. Our starting dose is 2 to 3 capsules with a meal, 1 to 2 with a snack and a nourishing drink. And you should be taking the 25,000 unit capsules, not the smaller 10,000 unit capsules. Your PERT capsules should be taken with your meals. So if you're taking a dose of 3 capsules per meal, I normally suggest spreading it through the meal. So taking 2 capsules at the start of the meal and then 1 halfway through. By the start of the meal, I mean literally before your first mouthful. Always swallow with a cold drink, never with a hot one. Swallow them whole if you can. And like we said, spread the dose throughout your meal if you can, because they tend to work a little better. If you struggle to swallow tablets, then you can open the capsules. And we suggest opening the capsule and put the tiny little balls in, mix it with something acidic, so yogurt or fruit puree or tomato sauce, and take it that way. Again, take it through the meal. It's really important that you rinse your mouth well after you've done this, because those little microspheres, they can get caught and they can cause some irritation in your mouth. Store at room temperature. Don't open your capsules and sprinkle directly onto a meal, because the heat from the meal will stop the enzymes from working properly and it will affect the taste of your meal and it won't be enjoyable. If you're taking your PERT capsules, but you're still getting symptoms of malabsorption, we need to check if the dose is correct. So we try and empower our patients to be confident to increase their PERT dose if they're still getting symptoms of malabsorption, and we suggest increasing by 1 capsule per meal and per snack until those symptoms of malabsorption are resolved. If you're still taking PERT and you're still getting symptoms of malabsorption, even though you've increased the dose, it may be that you need a PPI. So this is a medication that works to slightly lower the acidity level of your stomach. Very acidic environments aren't wonderful for Creon working well, your PERT working well. So the PPI can make it slightly more healthy environment, I suppose, for the PERT to work well. So your enzymes are not needed when you're having a single portion of fruit or veggies on their own. Any sugary sweets like marshmallows or jelly babies, tea or coffee with a drop of milk in, or other non-nourishing drinks like water, squash, fizzy drinks. Or if you've missed a meal, you don't need to take your PERT capsules. So common questions I get asked include, can I overdose? So if somebody has a diagnosis of pancreatic cancer, they can never take too many PERT capsules. What we aim is that they take the right number of capsules so that they no longer have symptoms of malabsorption, and that is the correct dose for them. But there's no upper limit on the amount that you can have. Should I follow a low-fat diet? So a low-fat diet can really exacerbate malnutrition, can make it much, much worse, because you're losing lots and lots of calories in your diet. But people with pancreatic cancer will notice that some of those really unpleasant side effects of malabsorption, like the greasy, oily, pale, yellow stools that are difficult to flush away, those symptoms go away once fat is taken out of the diet. And that's because those, the kind of greasiness, the oiliness, that's somebody malabsorbing fat. But we know if somebody is malabsorbing one of the macronutrients, that they're also going to be malabsorbing the other ones, just with fewer kind of overt symptoms. So what we suggest is include fat in your diet because it's so nourishing, and make sure you're taking your PERT dose correctly. If I don't snack, I won't have to take as many. Yeah, if you are not snacking, you wouldn't need to take any PERT, but remember, our aim is to build strength. So build strength because we know it helps to tolerate things like chemotherapy better, and it may help with the recovery from surgery. So what we recommend is lots of snacking through the day and take your PERT capsules. Does PERT contain animal products? Yeah, PERT is made using pork products, and this is something that we tell all of our patients. If somebody doesn't eat pork as part of their lifestyle, then we'll discuss kind of risks and benefits. We know that the vegetarian alternatives are not as efficient as the ones, not as effective as the ones that do contain pork products. So there's no real alternative. If somebody doesn't have pork in their diet as part of their religion, then because this is a medication that's required, it's allowed by the religion. But I would speak with your religious leader to get consent for that if you feel uncomfortable about taking it. I don't have symptoms of malabsorption. Do I still need PERT? So the pancreas is very clever in that it kind of, we don't get any symptoms of malabsorption until less than 10% of enzymes are being produced by the pancreas. So we know that when somebody has a diagnosis of pancreatic cancer, they're likely to be malabsorbing to some degree and probably have been for a while. So what we want to do is stop that malnutrition in its tracks, stop the malabsorption, and start taking PERT even if you don't have those really unpleasant symptoms of malabsorption. I forgot PERT with my meal. Should I take it now? So I'd normally say anything kind of longer than 10 minutes after your meal, then I wouldn't worry too much this time. Try and think about how you can take it next time to make sure that all of those nutrients are being absorbed. So if you tend to eat in front of the telly, can you put your PERT capsules in front of the TV or on the table with your salt and pepper? Or could you set an alarm on your telephone or ask a loved one to remind you? Try and figure out what will work for you to make sure that you're taking them with every meal and every snack. So type 3C diabetes is a diabetes that's as a result of a pancreatic condition like pancreatic cancer. So remember, the pancreas also makes hormones insulin and glucagon, which help to control our blood sugar levels. And insulin acts almost like a key. So whenever we eat our foods and they are absorbed by our bowel, the nutrients go into our bloodstream and then they're kind of sitting in the bloodstream. The insulin is there to open the cells to allow the nutrients into the cells, which then can be used by the body as fuel. If somebody isn't making enough insulin anymore, so if the cells have been damaged, or if somebody's had some surgery, for example, if there isn't enough insulin there, those nutrients can't move from the bloodstream into the cells because the key isn't there or the key isn't working, meaning those nutrients stay in the bloodstream. This causes high blood sugar levels or high blood glucose levels with a diagnosis there of type 3C diabetes. Now, because those nutrients can't move from the blood into our cells to be used as fuel, type 3C diabetes can make malnutrition worse because it's almost like the nutrients aren't there, they can't be used. So the body again will use its own stores of fuel, its fat, its protein to get everything that it needs, which can make malnutrition worse. So symptoms of high blood sugar would include lots of urination, especially overnight, feeling very thirsty that you can't quench, non-healing wounds, recurrent UTIs and ongoing weight loss. And be aware, if you're started on PERT, this might unmask your type 3C diabetes. So be aware of these symptoms. And if you've noticed these symptoms, then speak with your specialist nurse. So with the management of our type 3C diabetes, we use medications, whether that's oral or injectable, so insulin, regular monitoring of glucose levels, potentially some dietary changes, but in restriction of food is inappropriate in people who are malnourished. And our medication dose should always be altered to match oral intake. If someone's eating really well with pancreatic cancer and as a result their blood sugars are high, we'd never ask them to restrict what they're eating. What we would do is match their medication to make sure that their blood sugars are under control so they can keep eating well, but the sugars are well managed. And overall, our aim with eating and diet and type 3C diabetes is to prevent low and high blood sugars, so prevent hypoglycemia and hyperglycemia, prevent malnutrition, and avoid complications associated with diabetes, so nerve damage or sight loss. And the way that we want to do this is by eating regularly, so 3 meals a day, a couple of snacks, monitor your blood sugars regularly, ensure that you are absorbing all your nutrients from your food by taking your PERT capsules correctly. And if somebody is very well nourished and we're having a bit of difficulty getting a handle on blood sugars, we might have a look at whether there could be some changes made with their diet. So this would be a typical day's food: 3 meals and a couple of nourishing snacks for somebody with pancreatic cancer and type 3C diabetes. if somebody is very well nourished and their sugars are getting a little bit difficult to control, what we might do is think about certain foods in the diets. And one of those foods would be foods that have got a high glycemic index, high GI foods. So these types of foods are broken down very quickly by the body and they cause a big jump in blood sugar levels. And that would include things like white carbohydrates or things with added sugar like fizzy drinks or sugar in drinks like in your teas and coffees or things like jam or marmalade. And what we would do is try and focus on choosing whole grains, oats, pulses, no added sugar foods, and including fruit and vegetables, because these are foods that can help to keep your blood sugars fairly steady. So remember, when us as dietitians see people with pancreatic cancer, what we're aiming for is to build strength, so optimize nutritional status, because we know that that can help with their ongoing treatment, their chemotherapy or their surgery, and it can help to improve quality of life. And as part of this, we talk about diet and we encourage eating anything. So this means 3 meals a day, a couple of snacks and a pint of full cream milk daily if somebody can. There's nothing that's forbidden. There's nothing that's off the table. Everything is a fantastic food to eat. But remember, some choices are more nourishing than others. So remember, your carbohydrates are there to give your body energy. Your protein is there to build your strength and to help with wound healing. And we aim for at least usually 3 or more portions a day of protein foods. Remember, your fat is there to add lots of calories and to help with flavor. And we talk about enriching or fortifying foods, which we'll talk about in the next slide. And some people find that nutritional supplement drinks are really helpful. They're a really good way of getting lots of calories and lots of protein in a drink. But because they are so nourishing, they require enzyme tablets with every nutritional drink. So if you're prescribed oral nutritional supplements, so for example, Ensure or Fortisip, or you are buying some like Complan from the shop, you need to take your PERT capsules with these, treat them as a snack. So take, for example, 2 Creon or Nutrizyme tablets with each nutritional supplement drink to make sure that you're absorbing all of those nutrients from that drink. So enriching food is the process of adding additional calories and protein to enrich or fortify your foods. So we always say, always choose full fat options where you can add extra calories and protein. So this could be using things like skimmed milk powder or pea protein powder into things like mash, puddings, porridge, soup. Can you add nuts, ground nuts, nut butter or seeds into things like yogurt, porridge sauces to add extra calories and extra protein? You know, butter, olive oil spread, cheese, vegan cheese or cream, including vegan alternatives into things like mash, soup, porridge, custard. Again, adding more protein, more calories to try and build that strength up in preparation for your treatment. And then condensed milk, honey, syrup, nuts, dried fruit onto things like cereal and yogurt. And what we can compare here is a typical day and then an enriched day. So we've got day A is kind of 3 meals, a couple of snacks and some drinks throughout the day. And day B is your what we call enriched day. So we're using whole milk, adding skimmed milk powder, some honey and some double cream into porridge, switching out those biscuits for some crackers with butter and cheese, adding a handful of grated cheese into soup and adding some butter with the roll. And then with the evening meal, adding extra skimmed milk powder, cream cheese, whole milk into the mash, changing that low-fat yogurt for a high-protein yogurt, and adding peanut butter onto toast with the banana, and then choosing more nourishing drinks, so fruit juice, milky coffee, Bovril. And what we can see is that the amount of calories is doubled and the amount of protein is doubled. And we know that if somebody is consistently doing this, it's going to really help to build their strength. And we know that building the strength is so important to help tolerate their treatment better, so things like the chemotherapy, and it can help recover from surgery better. So we'll do a quick section here on duodenal stents. If somebody has pancreatic cancer, they may get a blockage in their bowel. This can cause lots of vomiting and the food not being able to move from the stomach through into the bowel. So a duodenal stent is a tube that is inserted and expands into the duodenum, that's the small bowel, and allows the food to move from the stomach into the rest of the bowel to be absorbed. When somebody has had a duodenal stent placed, we talk to them about the diet and what they're able to eat. So on the day of the insertion, we say just fluids, so tea, coffee, fruit juice, smooth soups, ice cream, jelly, and nutritional supplement drinks. And then 1 to 2 days after the insertion, then we progress on to kind of more soft food. So yogurts, mousse, scrambled eggs, cereal, mash, well-cooked pasta and rice, fish or meat in sauce, well-cooked meat, so meat that's been stewed, cottage pies, bolognese, and well-cooked vegetables. And we say these soft foods to make sure that things are able to move through that stent nice and easily. Some foods are problematic, and these would include bread, kind of hard, overcooked chips or roast potatoes. Grilled cheese toppings can be a bit problematic, as can things like stodgy foods like pastry. Nuts or chocolate with nuts and fruit in it. Stringy vegetables like green beans and celery. And then fruit and veggies that have got hard shells or skins on them, or lots of pith like oranges, grapes, sweet corn, baked beans. Those can be problematic as well. So we'd usually try and suggest avoiding those types of food. So we know when someone's having treatment for pancreatic cancer, it can impact on how well they can eat. So appetite can be affected, side effects such as nausea or taste changes can be seen. An impact of treatment on mood can affect how well somebody is able to eat. So have you or your loved one with pancreatic cancer experienced any difficulties with eating? So the answers there that we're seeing are things that we see very often when we see people with pancreatic cancer who are going through treatment. So lack of appetite, feeling full quickly, nausea and taste changes, and then a few people have said a sore or dry mouth as well. So the next few slides to hopefully give you some information on trying to manage those side effects. So we know that the side effects of the disease and side effects of cancer treatment can make eating and maintaining weight quite difficult. Eating can often no longer be enjoyment, it can be more of a chore. And cancer and treatment can alter the way your body uses the food you eat. When somebody has cancer, the body needs more energy to try and maintain its weight. But alongside that, what we see is often people lose their appetite. So as a result of the body needing more fuel, but eating less fuel, we see weight loss. But we know that eating a nutritious diet during cancer treatment can help with minimizing or preventing further weight loss. It can minimize delays of treatment, because if someone's very malnourished, then they might have delays in starting their treatment. It can help to reduce treatment-related side effects and can help with quality of life and overall survival. Cancer and treatments do affect everybody differently, and side effects can vary. And you'll see side effects with all types of treatment, including surgery, chemotherapy, and radiotherapy. So following surgery, what you can see is feeling full very quickly, tiredness, taste changes, reduced appetite, and then impact on your bowel, so diarrhea, malabsorption, or nausea and vomiting. We need to try and help somebody as well as possible during these periods, especially if they're having chemotherapy following surgery, because they need to be as fit as possible and help them to recover from that surgery that they've just had. And then with chemotherapy, we can see again sore mouth, taste changes, reduced appetite, similar GI symptoms, so diarrhea, malabsorption, nausea and vomiting, and overall fatigue again. Chemotherapy drugs work by damaging cancer cells, but it's not targeted. So it can also damage other cells, like the cells that are in your mouth and through your bowel. And that's why we see some of those side effects. So when you have a reduced appetite, we would try and encourage food fortification and enrichment. The British Dietetic Association has a really helpful food fact sheet on malnutrition, which will give you lots more tips on enriching your food. So I recommend you go and look for that on the internet. It's under the British Dietetic Association and the Food Facts tab. So we'll say try and have small portions, but more frequently through the day. Avoid filling up with non-nourishing drinks like water, fizzy drinks, tea or coffee, or watery soups. Choose the foods that you want to eat. So if you want a pizza for breakfast, have a pizza for breakfast, that's fine. And when you're feeling hungry, really take advantage. And blander foods might be better tolerated. If you feel full very quickly, again, that little and often tends to work quite well. Avoid fizzy drinks and avoid filling up on fluids before you're having a meal. And then if you are preferring drinks overall, choose nourishing drinks like milky drinks or smoothies or enriched soups. With nausea and sickness, this can be a result of your medications, but we know an empty stomach can make that nausea worse. So try and eat regularly and eat slowly, but in small amounts. Plain carbohydrate foods might be helpful, like toast, bread, biscuits, and pasta. Cold foods might work well, and avoid cooking when you're nauseous. So could you use ready meals? Could you ask somebody to cook for you? Could you get a takeaway? Sip cold fizzy drinks between meals, which might help to reduce that nausea. Choose those nourishing drinks that we've mentioned before, and salty foods might help. We know that greasy, spicy foods will probably make it worse. And ginger foods, so ginger biscuits, ginger ale, ginger tea, or ginger beer, that can help take the edge off the nausea so you can start to eat again. So there's lots of reasons why somebody could get a sore mouth during treatment. So from the chemotherapy, you might get an infection, you might get oral thrush, and that can impact on how well somebody is able to eat. So try and keep your mouth nice and moist, or use a straw if your lips are very sore. Soft, moist, bland foods are often easier. Cold foods can be very soothing, so ice cream, yogurt, or frozen things, so ice lollies, frozen fruit like pear, mango, apple. Avoid kind of very dry raw foods like nuts, muesli, breads. Citrus foods and tomato-based sauces are probably going to make it worse. And then reduce salt and seasonings, because that's just going to irritate it as well. And then try adding sauces to your food, gravy, custard, cream, for example. And if you have a dry mouth as well, the recommendations are fairly similar. So keep your mouth nice and moist. Use sauces where you can. Maintain good oral hygiene. Could you chew chewing gum or suck on hard-boiled sweets to help stimulate saliva? Salty, spicy foods and alcohol and caffeine can dry your mouth out, so we'd reduce these. And rinsing your mouth with flavoured water or sparkling water can help. And then artificial saliva can help as well. If you are getting taste and smell changes, this is really common. It's a result often of treatment or the medications, but there's no drugs that we can give to manage these. We do know that taste and smell changes usually change over time. So keep trying the foods that you'd normally enjoy, and try different types of foods, but persevere. Try cold foods, they might be more easily tolerated. And if tea and coffee isn't working for you, then try your nourishing drinks, your milk or your juice-based drinks. The food on the plate looking good can really, really help. So think about food presentation, and keep an eye on your mouth. If you're getting like a coating on your tongue, this could be oral thrush, and that can affect your taste. So keep an eye on that, and if you're getting that, then that can be easily treated using some medication. So sometimes food can taste bitter or metallic. So if you're having meat, this could be marinated in like a fruity sauce, like a sweet and sour, or choose alternatives to meat as your source of protein. So fish, eggs, lentils, yogurt, cheese. If your tea and coffee isn't tasting right, try hot chocolate or malted milk drinks. Rinse your mouth with flavoured or sparkling water, and try using plastic or wooden utensils instead of your metal ones. And then suck sweets, kind of lemon sherbets, fizzy sweets between meals. That will help to take that bitter or metallic taste away. If your food isn't tasting of much, can you use marinades? Could you add dressings and sauces like chutneys, salsa, mustard? Use strong or sharp flavours like herbs, lemon juice, pepper. Sharp flavors will increase that saliva production. So things like lemon, grapefruit, lime, pickles, vinegar, they can increase your saliva production and get your taste buds going, which might help. And then choose hot or warm foods. The taste buds readily detect these hot or warm foods easier, so you might be able to taste it a little bit better. Diarrhea is a common side effect of surgery and chemotherapy because the lining of the gut does get irritated. So we can see diarrhea often. If you are getting episodes of diarrhea, stay hydrated, sip frequently through the day. Can you use sports drink to help replace some of those salts? Eat small amounts regularly, so little and often, and then avoid very high fiber foods, things like beans or whole grains, raw fruit and veg, because this is likely to make the diarrhea worse. When the diarrhea is settled, you can start reintroducing these foods again. Avoid very greasy or fatty foods, and sweeteners and caffeine can make it worse, as can concentrated fruit juice. And we know that dealing with cancer and undergoing cancer treatment can be really draining, and can lead you to feeling very tired and fatigued. And this can impact on food preparation, shopping, and even being able to eat. So if you're feeling tired, can you ask for help? Could family or friends do your shopping or your cooking for you? Could you get an online food shop? When you're feeling like your energy levels are up, could you prepare meals and put them in the freezer if you have one? Eat foods that require little preparation, so use things like cheese and crackers, sandwiches, toast, tins of soup, things that don't need too much effort putting in. Make use of oral nutritional supplement drinks. They're really, really helpful. And maybe try meal services if you can, like Wiltshire Farm Foods or Oak House. And then when using a little bit of light exercise, it can help reduce fatigue and might increase appetite. And that's really nice now that the weather's getting a little bit better as well. A nice walk before your meal might help to get your appetite up a touch. And we know that eating can have a huge impact emotionally on somebody with pancreatic cancer and loved ones as well. It's a daily activity that we can't get away from. It's often very social. And then, somebody's own concerns about not eating the right foods or not eating enough. And then, unintentional pressure from family and friends about eating enough as well can be really tough to deal with. So speak with your family and friends about what you might find easier. Could we change up meal times? Could we make it, less social? Is there ways that you could distract yourself during meals, like, for example, watching the telly? What do you think is going to work for you? And set realistic goals. Even eating a small amount is a fantastic achievement with somebody with pancreatic cancer. Gentle support and encouragement is great. Try and do a touch of activity if you can to build some strength and build that appetite. And then when you're having a good day, then take advantage of that. There's some recipes and resources there. These are really helpful. They're really good way of getting lots of calories and protein in because they're often enriched recipes. So have a look at these if you can do. And then finally, we're just moving quickly there on to our myth busting session. So one of the things that we hear very often is sugar feeds cancer, and this is a myth. So sugar in some form is in lots of the foods that we eat, and this is good because our bodies rely heavily on it to work. So glucose is the basic fuel that powers all of our cells, and our body requires glucose to continue working. So carbohydrates are broken down into those single sugars for absorption by the body. All of our cells, whether they're cancerous or not, will use glucose for energy. Cancer cells usually grow very quickly using lots of fuel, which is where the myth comes from. If cancer cells grow very quickly and they need lots of fuel, if I stop eating that fuel, so sugar, then will it stop the cancer from growing? The body's very clever in that if we cut something out, then like glucose, it can actually make more glucose. And we can't direct where that glucose is going. It can't direct it towards the healthy cells, but not to the cancer cells. So there's no evidence at all to say that cutting out cancer will stop your cancer from growing or even stop it from developing in the first place. There's no evidence at all that happens. So sugar doesn't feed cancer. So we still recommend you have sugar within your diet, because it's a really nourishing thing to have, lots of calories, and it can help foods taste really good as well. I should only eat organic fruit and veggies, as pesticides used in non-organic foods increase cancer risk. And taking supplements such as wormwood reishi and chaga mushroom extract will reduce my risk of cancer developing. And these are both thankfully myths. So organic fruit and veggies tend to use fewer pesticides. Very, very high levels of pesticides may cause cancer in animals, but levels much, much, much lower than these are used in pesticides. And there's no evidence that a small amount of pesticides that might be ingested increases cancer risk. And there's no evidence that organic foods affects cancer risk, so either increases or decreases your chance of cancer developing. What we normally say is, if you usually choose organic foods, then you can continue doing that. If you don't normally choose organic food, there's no reason for you to start choosing these. And these supplements, so Shillington's liver gallbladder formula, reishi extract, chaga mushroom, and Shillington's body balance were just a few of the supplements that popped up when I Googled supplements for pancreatic cancer. And this was a website that recommended you take these supplements daily, or often more than once a day, at a price of £1,600 a year. And there's no evidence that taking these internet supplements will provide any benefit, and they could interfere with your chemotherapy treatment. And other supplements such as high-dose antioxidants, they may prevent cell damage, but they may stop your chemotherapies from working. So if you are going to take any supplements or are thinking about it, I would check with your oncology team before to make sure it's not going to affect how your chemotherapy is going to be working. If you're taking a kind of standard A to Z supplement from the supermarket, this should be absolutely fine. And for people who have had a period of malabsorption, we may recommend them for a short period. But just be aware of what you're reading on the internet, and go to a reputable source for information. So your specialist nurse, the dietitian, your GP, contact Pancreatic Cancer UK on the website, or the specialist phone lines, or contact the BDA and get some information there on the foods that you're eating, and NHS choices as well. So to conclude, so malabsorption can cause malnutrition. Malabsorption is well managed by taking PERT correctly. Dietary restriction is not appropriate in people who are malnourished or at risk of malnutrition. Using PERT and adopting nourishing dietary strategies will help with weight, cancer, treatment tolerance, and overall well-being. Try using different strategies to help with those side effects of your treatment, and use reputable information sources. And that's it. Thank you very much. And I think we'll move on to the Q&A session shortly. Thank you.
Rachel, thanks so much for all of that information that you have just provided for us all. I hope everybody listening has learned something, if not a lot. I've learned stuff again, so thank you. Have yourself a quick swig of water. We will move on to the question and answer session straight away, if that's okay. And just one thing to add, I think we might have one or two callers that are phoning or joined us by phone. So a little bit, I have to read my crib sheet. Just if people are joining by phone and they've got a question that they want to ask, please can you raise your hand by pressing *9. So *9 if you've got a question and you're calling by your phone, and you'll be prompted to unmute yourself and speak. So that's for participants joining by phone if you've got a particular question for us that you'd like to answer. And hopefully Ellie, who's my wonderful guru, will help notice that if I miss it. So *9 if you're on your phones and you want a question. But thank you, other than to Rachel, there's some questions already that have come into our Q&A box, which I'm just going to open to read. And thank you for putting all these questions forward, everybody. And I'm going to start at the top. I'm not sure, Rachel, if you can see them, but I'll read them out perhaps to start with. And it would be great for those that you think you can answer, and if I can be more helpful, then shout. So the first question you have, I think, covered in part, but not entirely. So is there a rule for how much creon with a given weight of fat or will that vary between individuals? So for example, I guess if you've got 10 grams of fat, is there a particular number of creon you should take?
So this would vary between individuals, because we don't know how much residual function somebody with pancreatic cancer has. So somebody might be producing more enzymes than somebody else. So it's difficult to kind of give a standard answer. So yeah, it will vary.
Right. And again, you base that on the person's symptoms of enzyme insufficiency to monitor how much that person needs.
Yeah, we'd look at the malabsorption and then kind of increase the dose up to the point where those symptoms are no longer there.
Brilliant. Thank you. Next question is from Louise. Thank you. Can you give advice on how to stimulate appetite in pancreatic cancer patients? So I think, again, you probably did cover a few of these bits in your presentation, but a few perhaps bullet points just to remind us how to stimulate appetite.
Yeah, it can be quite difficult to physically stimulate appetite. We know that appetite is affected, but we can't really increase it. But what we can do is kind of work around it. And that's where things like your little and often, the enriching food comes into play. We know if somebody's eating well as well, that can help to keep their appetite going. But there's nothing that we can really kind of give to you to kind of kickstart your appetite, unfortunately, which is it can be a real challenge for people.
And I think maybe I would also add to that possibly that if people are able to exercise, that sometimes that will stimulate somebody's appetite. So perhaps if you can go for as short a walk as you can or as long a walk as you can, that may increase some people's appetite. And depending on the level of somebody's appetite, that sometimes a low dose steroid might be prescribed if it was thought suitable. So something like dexamethasone sometimes is prescribed to some patients when they don't have a good appetite, not for a long-term treatment, but something perhaps to consider asking your healthcare professionals if that was appropriate as well. So the next question, can you have severe pancreatic insufficiency? And they've given a very specific fecal elastase of 78 and not be diabetic. So can you have a severe pancreatic insufficiency and not be diabetic is the first part of the question. So I'll go for one part first.
Yeah. So yeah, I suppose with pancreatic cancer, it depends whereabouts the damage to the cell is, or which part of the pancreas has been removed from surgery, or where the tumour is and how it's affecting where the pancreas works. What we could often see if the tumour or the cells have been damaged or removed in the head or the body of the pancreas, then we can see pancreatic exocrine insufficiency. So that's insufficiency of the enzymes being made and released. Whereas if somebody has had the tail of their pancreas affected, this was more likely to affect their diet, their blood sugar management. So yes, somebody could have severe pancreatic exocrine insufficiency with a low fecal elastase like that, but not be diabetic as well.
Thank you. And then the second part of this question is also, can a 4.5 centimetre kidney cyst affect the pancreas and its enzyme output? Are you happy to answer that, or do you want me to?
I would say I can't see why it would affect it, but I'm happy for you to go and answer and expand.
No, I'd agree. I think usually that would be two separate issues. I think if somebody has a cyst in their kidney, then that doesn't affect how the pancreas works. If they have a different problem in the pancreas, that will affect how the pancreas works, but it shouldn't be anything in relation specifically to the cyst in the kidney. So I hope that answers that question. Next question is, if you're eating a hot meal and sandwiching creon capsules throughout the meal, so I presume that means spacing it out through the meal, how much cold water should you take with the creon so it isn't warmed by the food? That's a question I sometimes get asked, is if you're having hot food afterwards, how does that affect your creon? I think that's probably the same sort of question.
Yeah, I would say just a mouthful of your cold drink would be absolutely fine too. It's the direct heat of the hot food that would stop the enzymes from working correctly. But once you've kind of swallowed the food, it'll be at a lower temperature in your stomach, and the temperature then shouldn't affect how well the creon's working. So I would, just use a mouthful of water if you can manage to take it with just that small amount.
Okay, thank you. Do you need to take creon with a banana?
So bananas are quite starchy. So some people might tolerate not needing Creon with a single banana. And the ways that we would know if they've tolerated or not is if they've eaten a banana and if they're getting lots of wind afterwards. That would be like the malabsorption of the carbohydrates. So it kind of depends on how much pancreatic function you've got left. As a general rule, we say probably take a snack dose of Creon if you're having something like a banana.
In my experience as well, and slightly more from the diabetes side, your banana can be quite different size. So a small banana, you might not need something, but large bananas can be quite large. So it's all down to your symptoms, as Rachel said, I think, really. Great. Next question from Alice is sweating at night a symptom? So I'm going to hazard a guess, but you can put your own guess on this, Rachel. Is it a sign of pancreatic enzyme insufficiency, is sweating?
I mean, if somebody's sweating, is that more of a symptom of hypoglycemia? Is this an endocrine insufficiency thing? Is somebody having a low blood sugar, and what we can see sometimes is kind of somebody feeling very shaky or very hungry or sweating a lot? It might be a result of that.
I think I would answer that similarly, and say that really probably sweating isn't really related to enzyme insufficiency and nutrition as such. Probably, as Rachel said, if somebody's having a hypo, so a low blood sugar, then one of those effects can be sweating. Otherwise, I'd be looking more at things possibly related to actually an infection. If it's always at night, is the temperature up? Are you actually perspiring lots? Occasionally we see people whose tumours cause them to actually sweat a lot, but it's something probably to discuss with your medical team. So I would say not specifically related to pancreatic enzymes and nutrition, unless as the low blood sugar. Next question from Carol. What symptoms would indicate a need for a duodenal stent? Good question. So you talked a little bit about duodenal stents and foods to eat afterwards. Are you happy to answer the symptoms of needing a duodenal stent? So
when we see people in the hospital who need a duodenal stent, they've normally been admitted with lots of vomiting, weight loss as a result of not being able to absorb the nutrients because they're not able to, the food isn't able to move through from their stomach. So usually it'd be lots of vomiting because of that blockage there, would be one of the symptoms. Is there anything else that you might be able to add?
Sometimes we do get people who phone us on the support line, and you to try and extract some more of the symptoms from them. And you're absolutely right, sort of large volume projectile, big vomits are quite a classic sign, but often it is sort of going off, appetite starting to go off. Sometimes people get a little bit bloated because the gas isn't passing through properly. And quite a late sign often is perhaps not passing wind down the way. So actually a little less gas is coming out through the bottom end and the stool will stop coming or slow down. So those can be signs. And sometimes abdominal distension. So before you have a big vomit, your food is building up in your stomach and not passing through. So those are the sort of classic ones really that I would think of. Next question. I'm still having floating stools with my Creon, and the dose has been increased to 5 per meal. But as it still is 50-50, my dietitian has advised I take all my 5 Creon at the start of my meal, but I can't see this is recommended in any literature, so could you comment, please? So how should this poor person be taking their Creon, would you say, Rachel?
What I would do is check that you're taking it in the way that we'd mentioned previously. So always with a cold drink, make sure it's stored correctly. So it's not stored anywhere that's very hot, because that can stop it working as well. When I see somebody who's on a fairly large dose and on 3 or more capsules per meal, I do tend to recommend that they spread it throughout the meal. So there's no, I think you'll be hard pushed to find any kind of definitive evidence that taking it at the start versus throughout will or will not improve your symptoms, because nobody has done any kind of randomized trials on that type of thing. But because if somebody is taking a large amount of capsules, it can be quite challenging to take that amount of capsules all in one go at the start. And if somebody is taking a large amount of capsules they might be taking a while to eat their meal because they may be getting other symptoms of malabsorption, like feeling full very quickly. So it might be taking them a while to get through a full meal. So it just kind of spreads it out for you. So that's what I would usually recommend you do. So if you're taking 5, I'd probably say take 2 at the beginning, just before your first mouthful, 2 kind of a third of the way through, and then 1 kind of towards the end of your meal, just to spread it a little bit.
I agree. I often recommend exactly that to patients. I think if you think of it as your mouth, your esophagus, so your food pipe, your stomach, and then usually your enzymes would join your food after the stomach, that all that food's got to get through your stomach and be digested and move through, that all of that food needs some of the tablets. So if you have them all at the beginning, is the end bit of your meal getting contact with those enzymes? I always suspect it doesn't, and that's why partly the reason I would recommend spreading it through the meal.
Yeah.
Yeah. So next question. If experiencing diarrhea, it would be best to avoid milky foods and drinks still? That's the question. What alternatives would still provide high calories or nutrients in order to keep putting on weight and feel more energetic? So if somebody's having diarrhea still, first bit of the question, would you recommend avoiding milky foods and drinks?
I wouldn't recommend avoiding these drinks. I think we have to think about what the cause of the diarrhea is. So is it because you're malabsorbing, or is it another reason? Or is it, you know, is milky foods, is that something that's already caused you diarrhea previous to your pancreatic cancer diagnosis? But for somebody who would normally tolerate milk and they're having some diarrhea, I wouldn't say avoid milky drinks, because they are really, really nourishing. That said, if you're finding that you can't manage them and you can't tolerate your milky drinks, there's lots of other foods that can contain lots and lots of calories. So, for example, choosing the slides that we spoke about earlier, so choosing kind of high calorie, high protein foods is really helpful. So could you snack on things like nuts? Could you add kind of nut butters to things like your porridge or cereal, for example? Could you use a milk alternative? So could you use pea milk now? It's very high in protein. That could be a good alternative. Or soya yogurts, to try and avoid those more milky things. And choosing and using the resources that we've mentioned there. So visiting the British Dietetic Association and using the food facts website sheet. That will help to give you lots of information on enriching and choosing high calorie foods. But and make sure that you're taking your PERT capsules correctly as well. You know, are you getting symptoms of malabsorption? Is that why you're having diarrhea? Do we need to change that? So think about that as well.
Before I re-ask the second half of that question, I had a really good question from somebody in one of our online sessions, and they asked about, they'd always been milk intolerant, and they wanted to know about food fortification. So I suggested adding dried skim milk powder to fortify the food, and they asked whether there was a particular non-dairy option. Is that something you know about or can comment upon if anybody else is in that situation?
There is kind of protein powders that you could add. So things like pea protein powder is probably a fairly good alternative. It's quite high in protein. That's often kind of protein powders are kind of viewed as people who go to the gym very often will use protein powders. But they could be used in this instance as like an enricher of what you're eating, adding extra calories and protein. So that would be a good non-dairy alternative.
Need to accommodate that because it's protein with your Creon dosing as well, in theory.
Yeah, you
dependent.
Yeah, absolutely. Make sure that you're taking your Creon with that. Absolutely, yeah.
Great, thank you. Sorry to add my own question in. And the second half of that question was, what alternatives would still provide high calories of nutrients in order to put on weight? I think you've asked that actually, and feeling more energetic. I think you did just answer that, didn't you?
Yeah.
All right, thank you.
Sorry, I jumped ahead.
You jumped ahead, it's good. Before I forget, have a question that was also asked prior to the webinar. So somebody sent in a question. So before I forget to ask that, because I've got other ones on my screen, I've been prescribed omeprazole 2 tablets every morning. What benefit does omeprazole bring working alongside Creon? And is this short term, or will it be necessary to keep taking it forever as you do with the Creon? So I think you did touch on PPI, so how you reduce the acidity in the stomach. So perhaps if you could just go briefly back over that again, and is that needed to be done lifelong?
So with your PERT capsules, so your Creon or your Nutrizyme, sometimes they can get damaged by the acidity in our stomach. So a PPI like omeprazole or lansoprazole, they can help to stop the stomach being quite so acidic, meaning that the PERT capsules can move through the stomach kind of unharmed and get to the top part of the small bowel, the duodenum, where they do their work properly. So I would say continue taking that omeprazole. In terms of whether it's lifelong, I'm not the best person to advise on that, but we know that Creon is lifelong, and if somebody is needing a PPI like omeprazole to make sure that the Creon's working, I would suspect it'd be a longer term issue. Is that right, Lisa?
Yeah, I'd agree. I think I would suggest actually for this question, probably go back and ask your medical team directly. It probably partly depends on your symptoms of any enzyme insufficiency. So all the symptoms that Rachel's talked about, if you're still having those, are you having the right dose of PERT? Do you have any other reason why you're taking the omeprazole? So quite often after surgery, patients will be given an omeprazole, lansoprazole proton pump inhibitor to protect their stomachs. Where I used to work, we perhaps used to prescribe that for 6 weeks or so, and then quite often that would actually be stopped, not thinking probably about the relationship to enzymes at all. But if you're a person that is perhaps more likely to develop stomach ulcers, you have other reasons to develop acid in your stomach and stomach ulcers, discuss it with your clinicians as to whether this is particularly necessary for you for life, or if you're having I think the 2 tablets every morning, if they're 20 milligram tablets, that's 40 milligrams. It's a relatively high dose. I mean, you can have higher, but maybe you could ask, do you need such a high dose? Could you have just 20 milligrams, 1 tablet once a day? And review the symptoms, I think would be my recommendation. Next question. So from Jane, if you're still experiencing wind, even after increasing Creon intake, is there anything else you can do to prevent this? So this is, I've already increased my Creon, but I've still got wind.
So if we see somebody who's malabsorption, who's got malabsorbing, who's got lots of wind, then we normally would attribute this to kind of malabsorption of carbohydrates. So I'd have a look at other symptoms of malabsorption as well. So are you getting any of the other symptoms, kind of feeling full very quickly, or running to the toilet, or kind of the greasy, oily, pale stools? Are you getting any of those other symptoms? If you're not getting any of those other symptoms, do we think that the bloating is a part of the malabsorption? I'm not sure. So what I would do is make sure that you are not malabsorbing, getting any of those other symptoms of malabsorption. If you're still if you're maintaining your weight or increasing your weight, again, that's a sign that you're probably absorbing all of your nutrients, and maybe the wind is to do with something else. So I don't know, you might need maybe a little bit of Buscopan or something to try and help ease that that wind, but think about the other symptoms of malabsorption as well.
Thank you. Next question. If you are taking lithium tablets once daily to treat bipolar disorder and you have pancreatic cancer, will the absorption of this lithium be affected by a pancreatic tumour?
I wouldn't know.
Okay, I'm going to be honest, I didn't have a clue, but I saw this question come up earlier, so I got out Dr. Google. So I think probably the honest answer is this is a better question for your medics rather than perhaps Rachel or I. But my reading very briefly, and it is very briefly, is that lithium is apparently rapidly absorbed in the guts and it's not protein bound. So that's me thinking that the enzyme shouldn't really affect how the lithium is absorbed and it's excreted. So the actual levels of the lithium in your blood is got rid of through the kidneys. So I suspect having pancreatic tumour should not affect your lithium tablets and how it's absorbed. But I would much rather you go back and ask the prescribing doctors that question. I think things like lithium levels can be affected with things like kidney function and dehydration and things like that. So if a patient becomes dehydrated, has lots of diarrhea, that may well affect how your lithium levels are. So that's as clever as I can be, and I would probably take your clever question back to your doctors. But I think my simple answer is it shouldn't be affected by your pancreatic cancer. I hope that helps. Is indigestion a feature of post-operative symptoms?
It may be. We can see that following a surgery, there's lots of symptoms that somebody get which they didn't have previously, and an indigestion may be one of those. Lisa, you've mentioned there that a PPI might be started for a period following surgery. So potentially, but again, I would probably say ask your medical team about that, to be honest.
And I think perhaps depends slightly what those indigestion signs are. So is it a little bit more sort of acidy, refluxy and sort of base of your sternum, or is it more wind related? Is it affected by lying down or sitting up? And depends how far out from surgery that you are. So, you know, if you're only 1 month post-surgery, then everything is still settling down in your guts and things are learning how to transit through, the food's learning to transit through there, and it may well be a feature at that stage. But if you're 3 months, 6 months, 2 years post-surgery, I would suspect less so. So I hope that's helpful. Next question, should you avoid processed meats? They are classified as a class 1 carcinogenic by the WHO, same as tobacco. So you did mention sugars, but I don't think, I might have missed it, sorry if I did. You mentioned avoiding processed meats. What would your comment be on that, Rachel?
I think we have to think about what the priority is. So for somebody who's healthy and you know, they're not affected by cancer, then we would normally say kind of limit very processed meats and maybe have a couple of days of meat-free days, because we know overall this can be very, this is good for our health and it can long-term reduce the risk of cancer. But if somebody has pancreatic cancer or another type of cancer and they're malnourished, and one of the foods that they enjoy or able to eat is processed meats, then we have to think about what the priority is. And the priority for us would be trying to build strength, because we know that that is going to help somebody tolerate their treatment better and help recover from treatment as well. So shorter term, I wouldn't say avoid processed meats if this is an important part of your diet, because the priority is building strength in the short term. And longer term, whether it's following surgery and chemotherapy and you're in remission and you know, you're kind of back to a healthy diet, then at that stage we would say limit the amount of those processed meats that you have. I hope that's answered the question.
Great, thank you. Next one's about omega-3 fish oils specifically. So does taking omega-3 fish oils aid absorption?
Not that I'm aware of. I know there's been some talk about omega-3 omega oils and pancreatic cancer and whether they can help with kind of weight maintenance. There isn't a huge amount of evidence around taking these. There's no evidence for us to recommend them at this stage, but from an absorption point of view, no, they wouldn't affect absorption. What we do know is it's going to affect your absorption is your pancreatic enzymes or your PERT capsules.
And we're talking slightly on vitamins and oils and the such like. Do you recommend your patients have sort of vitamin blood levels checked at a particular time point, either through treatment or if they're, as you mentioned, in remission? Is there sort of absorption through the gut, and having the right amount of enzymes to make sure those things are all absorbed is important? Is there an argument to say annual blood tests should be done? I don't think there's a protocol for such things, is there?
No, I don't think there is a protocol. And, you know, when I see people in the hospital, we would normally check their blood results. So we will see what their bloods are doing at that stage. Kind of longer term, yeah, like they say, there isn't a protocol. But I think, you know, we know that exocrine insufficiency and malabsorption can decrease over time. So if somebody has a certain amount of pancreatic function left post-surgery, maybe a year or two down the line, it might be less, meaning that they are again becoming at risk of being malnourished. So I do think there is an argument for kind of annual blood checks of your vitamin and mineral status, particularly, you know, your fat soluble vitamins, your vitamin D is really important. So, but it's difficult. Is your GP gonna do those on request? But I think I do think there is a yeah, an argument for it for sure.
Well done. What are the best food supplements, so Fortisip, etc., And are the powders better than the drinks? So not that we're into promoting particular brands, but is there do you have a preference for what you would?
To be honest, it's all personal preference. Some people really enjoy Ensures, some people might really enjoy Fortisip, some people might make their own nutritional supplements at home. And I think the focus is what works best for you. They're all pretty much of a muchness in that they normally have a certain amount of calories, a certain amount of protein, and it's fairly standard across the board. And they've also got vitamins and minerals up there. In terms of the powdered ones, they're no better or worse, but some people tolerate the taste a little bit better. They're more like a standard milkshake that you might make at home because it's mixed with milk and it's a powder. So people find them maybe a touch easier, but there's none that are particularly better or worse than the others. They're all fairly good.
As you say, it's quite often about taste preference, isn't it? So I describe them sometimes as a bit more cordial based or juice based or more milky based. So if you have a preference for one or the other, then choose that. Can I only eat 3 main meals and 2 to 3 snacks a day with Creon? Or can I have as many snacks as I want in between meals, provided I take Creon with them? And does it matter if I eat a snack with a Creon just an hour after a main meal? So it's about Creon dosing and food timings, I suspect.
So if you are feeling that you want to snack, I would say snack as often as you want to, for sure. Certainly if you are coming up to treatment or you're trying to kind of rebuild your strength coming into treatment or following a treatment, we recommend lots of snacking. And you, as long as you take your PERT or your Creon with each of your snacks, that makes sure that you're absorbing all those nutrients properly. And in terms of timing of your snacks, if you feel that you want to eat fairly quickly after you've had a main meal, then absolutely just go for it. Just take your PERT capsules every time.
Basically Creon, or whatever your PERT is with whatever you eat. And the more you can eat, if you need to put on weight or maintain your weight, go for it.
Yeah, absolutely. I mean, I'm sure you've all noticed I'm very pro food. So if you want to eat, then I'm very much go for it. There's no limits from my point of view about what you can eat and how often you can eat.
Great. So we're down to the last 2 questions. So this is brilliant. Thank you, Rachel. So Leroy says, is it okay to drink lactaid milk in place of regular milk? I'm not sure I know what lactaid is. Do you know what lactaid milk is? That lactose?
So yes, I think it's a lactose-free version of milk. So I would say it's fine. Just make sure that you're taking your enzyme tablets with it. I suppose the question is, why do you want to take it? Is that because it's a taste preference? Is this because you're getting some symptoms with regular milk? Did you have those symptoms before you had pancreatic cancer? So are those symptoms a part of a malabsorption? So think about why you want to have it. But standard answer, yes, it's fine to take. I believe they do different versions of lactate milk. So I think they do kind of a protein version. I think they've got a calcium enriched version. So think about whether you want to choose one of those options, because it's going to be more nourishing. If it's calcium rich, that's fantastic, rather than maybe just the standard version, just to try and enrich your diet overall.
Thank you. All right, on to the last question, or nearly the last question. I'm going to struggle to read this one. It sounds too complex. How can you treat vitamin E gamma, tocopherol deficiency?
Yeah,
tocopherol. Okay, my GI, so my doctor said to get it through the diet, but because of my exocrine pancreatic insufficiency, I cannot have things that are rich in it, like nuts, for instance. So I'm guessing this is a vitamin E question. Do you recommend a supplement with something else? I'm sorry, I don't understand or know my ignorance of the gamma tocopherol part of it. I'm going to say vitamin E, and you can correct me when you know more.
So what I think my main focus on that question is them saying that they can't have foods that contain vitamin E, like nuts or seeds, for example, because of exocrine insufficiency. I guess we have to highlight that there's no reason why somebody shouldn't have these types of food if they've got exocrine insufficiency. You know, seeds and nuts, which are a source of vitamin E, are also a really good source of protein, and they give us lots of calories. So it'd be type of food that we'd like to include if they can. So if somebody has tried those foods and not tolerated them, is it because they weren't being taken with enzyme tablets? And was that the reason that they weren't tolerated? So I would think about re-including those types of food with appropriate enzymes to make sure that you're absorbing it. In terms of a supplement, you know, a standard A to Z supplement from the supermarket should be absolutely fine. But I wouldn't suggest anything beyond that, because I'm not sure whether it would interfere with any treatment that you're having already. So that might be something that you would speak with your specialist medical team about, rather than just your GP. But I encourage you to try and include those sources of vitamin E back into your diet, your nuts, your seeds, some fortified foods if you can, to get that vitamin E in.
With appropriate creon to see it, or enzymes to see if that helps the absorption, perhaps the symptoms associated with. Thank you. And then the last question now is, what's the difference between the different kinds of enzymes? It's a good question, actually, which, unless you've had to read about it, most people don't know. So we've talked predominantly about Creon as one of the brands which is most often prescribed, but you're absolutely right from this question. Nutrizim, Pancreatic, there are other types of enzymes. Rachel, what's the difference in them?
So they're generally fairly kind of the same, but they have some enzyme tablets have different levels of enzymes in them compared to the other ones. So Nutrizim, for example, will have higher levels of amylase in it compared to Creon capsules. So what we could see there is some people might not tolerate Creon, for example, which is obviously which is usually the first line PERT capsule. They might not tolerate it for whatever reason. And then what we'd normally do is try them on a different type, and maybe that kind of balance, the different balance of enzymes within that capsule, might work slightly better for you. But basically they're pretty much the same in that they're doing the same job. It's just the composition might be slightly different.
It's usually the amylase, the protease, the lipase concentrations are very slightly different between them, isn't it?
Yeah.
Great. Another one's just snuck in. Is a feeling of being always full always a sign of malabsorption, or could it be something else?
I mean, I suppose it could be something else. So I know we've spoken there about if somebody needs a duodenal stent, and the symptoms of that, you know, feeling full might be a symptom of something like that. But I think for me, malabsorption would always be one of the main causes of feeling full all the time, or feeling full very quickly. And I would have a look at that enzyme dose, see whether the dose needs increasing or taken in a slightly different way, and see if that helps with that feeling of fullness.
Also, perhaps if those symptoms, the question is about always feeling full, but has that changed over a period of time? So has that remained the same for months and months, weeks and weeks, or has it progressively got worse? And that would probably raise more questions, perhaps, about either an obstruction, or, you know, are you just a person that's better having little and often food? Or are you a person that may have had surgery not that long ago and your stomach's still expanding and getting used to having a bit more food? So can be other reasons, but I think malabsorption to be excluded would be the first thing to do. Right, I think we are nearly out of time and perfectly timed with everybody's lovely questions. So firstly, a big thank you, just to wrap things up, a big thank you to Rachel today, especially in the absence of her co-pilot, usually Lauren. Thank you so much, Rachel, for everything you've talked about today, all the tips and hints and support and ways to get extra calories in. I was salivating when you were talking about the saliva stimulating vinegars and citrusy things. So I hope people have found some helpful things. I'm sure you have from Rachel's talk today.
Thank you very much. Yeah, hopefully it's helped some people out there. So, and then there's obviously the recording if people need to go back over anything as well.
Exactly. So yeah, this, as Rachel's just pointed out, this will be recorded in the next couple of days. You'll be able to access it back through our website again. And then just a final plea before we say goodbye is there will be a feedback questionnaire sent to you just after we log out of the meeting. If you could possibly do that, we'd be really appreciative, just so, you know, if we can do it better, how can we do this better in the future? Has this been useful? It's just so we can learn and make this a better event for everybody going forward. So I'm going to say a big thank you, especially to Rachel and everybody that's helped organise today, and thank you to you lovely people that have joined us. I really hope it's been helpful, and thank you for some nice comments that have just come in already. But thank you all, and good night.
Thank you. Good night.